Why we need a new good anti-tubercular drug is because these second line drugs are very costly. They are quite toxic, that is more toxic than the first line drugs which we routinely use for the treatment of TB, and they have to be given for a longer duration also. And of course the efficacy of second line drugs is less than the first line drugs which we usually use. So we need a drug which should be a wonder drug, as people might call it, but it should be cost effective, it should be affordable for the patient, it should be able to treat this disease properly in combination with other existing drugs, and of course should have less number of side effects and should be able to decrease the duration of treatment effectively. So much so that the patient does not have relapse, because once the patient gets cured, he should not again come back with the same symptoms and come back with the same disease, that is he should not have relapse. That is our goal of treatment. Whenever we treat a case of tuberculosis, the first and foremost thing which we must remember is we have to make this patient non-infectious, because this disease gets transmitted from organisms in the atmosphere, and a patient who is harboring the organism is discharging them. So it is of utmost importance that the organisms which are released by the patient should be dead, should be taken care of immediately, and patient is converted to sputum negative status as early as possible by an effective drug. And otherwise the person who is a drug resistant case spreads a drug resistant disease in the contacts or the persons who come in contact with such a patient. So this is of utmost importance that a patient of tuberculosis, whether he is a freshly detected case or a drug resistant case, he must be converted to sputum negativity as early as possible. And that is why whenever tuberculosis is treated, we give maximum number of drugs at the time of diagnosis. You will be surprised to know that at least or minimum 4 drugs are given even to a fresh case of TB to treat and convert him to be, or to make him become sputum negative. And after that, once we are very sure that he is not discharging live organisms or his sputum has become negative, after at least 2 months of treatment, then only we put him on less number of drugs for the further period to complete his treatment. The duration of treatment is only 6 months in freshly detected cases, whereas if you compare, it is 4 times more. The duration is 4 times more needed to treat a patient of drug resistant tuberculosis. It is very important for everybody to understand that this problem can be treated very properly at the start only, that is initially when a patient is diagnosed as a case of tuberculosis. It is very easy to treat provided we give him a right dose of the drug for right duration and in the right combination, and of course we counsel the patient every time we meet. At the time of diagnosis also we counsel the patient that such and such drugs are being given. The duration is slightly longer, but the patient will be kept under observation. He will be examined thoroughly at every visit time when he is scheduled for a visit, and we will ensure that his treatment is taken completely and he is cured of the disease. And every time when the patient visits the doctor, it is mandatory for him to counsel the patient and let the patient know at what stage he is, how he has responded, and if he has not responded, it's mandatory to look into the reasons of why the patient is not responding. So a patient who is given treatment for the first time does not get converted or does not become sputum negative at the end of 2 months. This is the time when we really start suspecting that probably this is a drug resistant case. Even a patient who is a contact of a drug resistant case is also suspected for the same and is immediately screened whether he has drug resistant TB. He is investigated and treated accordingly. I am sure a new drug which really satisfies all these criteria of having cost effective benefits, less toxic, is affordable for everybody, easy to implement even in the program with combination of other drugs, would definitely give a new ray of hope for all those thousands and lakhs of patients who are suffering from tuberculosis, and will also be a boon for all the doctors who are treating and the program managers who are always looking for a good drug to be implemented in the control program of this disease.